Hi everyone, welcome back. So I thought it would be fun to look at how ultrasound technology has been portrayed in Singapore news. I'll be covering the period 1970s to 90s, mostly because this is when the technology came to Singapore and started becoming popular. So the first mention of ultrasound I could find was in 1969. I could not open this article. It's only available to read on the machines in the National Library in Singapore. So if you want, you can go there and get the microfilm and you can read it. But basically, it mentions that this instrument from the Federal Republic of Germany has become an important aid to gynecologists. So it's called Vidoson, makes ultrasound useful for diagnostic purposes. In 1975, so in this article, which talks about the different testing available for pregnant mothers. In the days of midwives and home deliveries, mothers to be who develop complications before or during birth face the risk of losing their babies or even their lives. Today, however, new equipment and techniques have reached a degree of sophistication adequate to deal with any emergency that may arise. So here they mentioned ultrasound. You can see on the last column here. By the way, this video is going to have a lot of text, obviously, because I was looking at newspapers. So if you want to read the original article, you can go to the National Library Board's website and look at the newspaper archives. I have put the titles of the articles. You can search and read the whole thing, or you can just pause the video and read it if you can zoom in enough. Otherwise, if it's boring, you can also just listen. I'll read out certain excerpts of the articles. So here it says, for instance, next January, so 1976, Kadang Kerbau Maternity Hospital will be taking delivery of an ultrasound machine, which is one of the latest breakthroughs in medical technology. Using the principle of deflected sound waves, the machine can measure the size of the baby, usually its head, as well as monitor its heartbeat, determine the baby's position, and the presence of twins. By running a detector over the abdomen of the expectant mother, an image is made on a screen very much like a television screen. From the pattern, the outline of the baby can be seen clearly. This ultrasound machine will be the second to be bought by the authorities. The first was installed some time ago at Bumpton Road Hospital, but it has since broken down. So in 1976, to say that the outline of the baby can be seen clearly, I do remember seeing my little brother was born in 1989. I saw an ultrasound of him as a fetus, and it was really blurry, black and white. So here in 1975, maybe it's a bit optimistic. So many private gynecologists bought these machines, and they used it mainly to monitor the baby's heartbeat. So that's all we know in 1975. So before ultrasound technology, what was really being used at that time for diagnosing conditions in pregnancy were X-rays. So even this is the same article. So they say here that X-rays are sometimes used to determine things such as the presence of twins, size of the pelvic girdle, and other anatomical details. Overexposure to X-rays are known to have harmful effects on fetuses and can, in extreme cases, cause deformities and an increased risk in leukemia in the child later on. However, mothers need not worry unnecessarily if they should be told to have X-rays taken, as the occasional exposure is not likely to do harm, and the information gathered from the X-ray far outweigh what little risk there may be. So here they say, okay, X-rays are benefit outweighs the harm. And another form of testing they had at this time, 1975, was to have amniocentesis. Here it says synthesis, but it's spelled CN, synthesis. So they would take some fluid from the amniotic fluid through a needle and then do testing on it. And then here they admit that, okay, another type of Mongol, I think they mean maybe Down syndrome, is one which results from environmental influences such as sensitivity to X rays. When affected, the fetus may develop abnormal chromosomes. They then result in regular Mongols. So here they do acknowledge that maybe X rays can harm the fetus. And it's accompanied with this image of an infant incubator. Although it's quite dark, it's hard to see, but those holes are where the nurse or the parent can put their hands in. So now, 1978. So you want to know baby sex? This appeared in the Straits Times. This article is addressed to women who are pregnant and who may want to find out the sex of their baby. The writer says that it's quite difficult to find out the sex, and through if you don't do proper testing, it's just For example, like, if your mother, grandmother, relatives say things like your belly is pointed or rounded, or your baby is kicking vigorously or less vigorously, then it's a boy or girl. So the article states two fairly reliable scientific methods of sex determination, which is amniocentesis, again, using the needle to get a sample of amniotic fluid, and by ultrasound. And here, ultrasound, they explain it involves the use of sound waves above the range of hearing directed at the abdomen onto the pregnancy, and the reflection of the sound waves by the pregnancy onto a screen creates a visual image. Sex determination involves the visualization of the external genital parts of the male baby. So if you don't see anything, then it's a female baby. The scan takes about 2 to 3 minutes, and it can be done with a portable model. However, it is expensive, about $50 to $70 per scan. This is 1978. And here they also mention X-ray again because in this time, X-ray was the main technology, right? So it's making a difference between ultrasound and X-ray. So X-ray is not the same, and it cannot be used for sex determination because it shows only bones. In 1979, in an article, How Can a Woman Tell She Is in the Family Way, which appeared in the Straits Times, and is generally talking about the signs of pregnancy. It mentions there are some gadgets that doctors have that one can use to determine a pregnancy. The only the only absolute signs of pregnancy consist of hearing of the fetal heart and palpation of the fetal parts by the doctor. Palpation means using hands to touch the belly. Nowadays, doctors have sophisticated gadgets for you to hear your baby's heartbeat. X-rays visualize your baby's skeleton and are useful to detect multiple pregnancies, abnormalities, and assess your baby's maturity. And here, it is safe to X-ray after the fourth month of pregnancy. This is quite a contrast to today, where pregnant women are warned even at the dentist. They are at the dentist office. You are asked if you are pregnant, if they want to do an X-ray of your mouth, and obviously now there's a lot of protection. If you have to take an X-ray of something, like you have to wear a lead blanket for the other parts of your body so that you don't get unnecessary X-rays. But here it says in 1979, it was quite safe to X-ray after the fourth month. There are no ill effects on the baby. But for those who object to X-rays, there is ultrasound visualization. In 1981, in an article in the New Nation called "Watching Baby Grow in the Womb," what could be better than a film of baby speaking his first words or taking his first steps? A video recording of baby in the womb. Impossible, you say? But this is not only possible, you can get it done here. The magic word is ultrasound. Using ultrasound, you can now videotape your unborn child right up to the time he is about to be born. This marvel of modern medical science not only provides you with a recording of your unborn child, it also plots the growth of the fetus over the months. And most important of all, it may detect any abnormalities the fetus may have, and it can actually give you better than an educated guess whether you're going to have a boy or girl. Ideally, 4 recordings are done in week 16, 24, 32, and 36. Okay, these are guidelines only and may vary. This is 1981. They were doing 4 scans. Yeah, so they promise you will be able to see the head, abdomen, limbs, buttocks, thighs, kidneys, heart, and most importantly, the absence of the scrotal sac or the penis. Okay, to tell the sex of the baby. This part interesting. For Chinese parents, a video of the fetus would also brighten up the traditional celebration for baby's first month. And for all parents, it will be a wonderful birthday present for the baby when he's old enough to appreciate it. What you will see is not an ordinary video picture, but shadows which will pulsate off and on. To make things easier for the untrained eye, a pointer can be used to indicate the various parts being viewed. You can even choose the video system that fits your video recorder. It costs $250, between $250 to $300. So this reads more like an advertisement that appeared in the New Nation. The picture that accompanies the article shows a TV screen, but I really can't tell what is on the screen. So like I said, what I remember seeing from a 1988 ultrasound scan was very blurry. I don't know which parts or organs they can really see. But interesting, this is an example of the commercialization of this technology, sounding very positive and optimistic about it, promising a video, what sounds like it could be quite a good quality video. Same year, 1981, in the Straits Times, X-ray facilities among the best in region. So here it says that X-rays have long been one of the most valuable methods for diagnosing illnesses. In recent years, spectacular advances have made them even more important. They mentioned the CAT scanner, that was an invention of the 1970s. It uses X-ray technology. There are also there's a method called fluoroscopy, I think. Radiologists use special long tubes and insert them into the blood vessel systems in order to study the blood supply of organs. Another technology they mention here is ultrasound. Other new machines increase the accuracy of X-ray examinations generally. So now they introduce ultrasound. This is an important step forward. Ultrasound has been increasingly used for some years now for pregnancy and heart cases because it does not carry radiation or surgical risks. Okay, this is a picture of fluoroscopy, which is X-ray technology using the flexible tube. And this is a picture of a modern ultrasound unit. So they used in diagnostic radiology. It looks quite massive. It looks like a CAT scanner actually. So that's interesting. I have not seen such a machine before. All right, 1981, X-ray therapy. Sorry, this headline is wrong. This is 1981. Okay, so they're talking about X-ray again. So one of the risks they mentioned about fluoroscopy, about the tube, the tubes used by radiologists may perforate the bowel, leading to potentially lethal infections from seepage of intestinal contents into the abdominal cavity. Severe bleeding can result if the liver or other organs is torn. However, on balance, the benefits have far outweighed the risks. Okay, this is a statement that is often said. I find it's even to the point that it sounds almost religious because when do they ever say that the risks of harm outweigh the benefits? It's always the benefits outweigh the risks. 1981. This was in the New Nation in a little section called Doc's Casebook. Doc like doctor. Machine that tells sex of unborn child. So it's a letter someone wrote in. I'm 8 months pregnant and recently my obstetrician sent me for what was called an ultrasound scan. It's amazing, but he could tell me I'm going to have a girl. Can I take his word for it? Why didn't he send me for a similar scan during my last two pregnancies? Most of my girlfriends don't even know of the existence of this machine. The ultrasound is a very new machine, which explains why your friends do not know of it. Your earlier pregnancies probably took place before it was introduced. The ultrasound can be likened to an X-ray in that it produces a picture of the unborn child. It takes a great deal of study and practice to learn how to interpret the readings. But once mastered, the ultrasound can give accurate, useful information. Ultrasound is also used to check if the baby is too big, then you can have a cesarean. The first scan can be done around 30 weeks, that is 7.5 months, and repeated later if necessary. Okay, so it's like conflicting information. So we know so far that ultrasound was introduced in the public hospital, Kandang Kerbau, in 1976. In the private hospitals, they were already around from the 70s. And then there was some guidelines saying you can do 4 scans in a pregnancy, and this one is saying 1 scan around 30 weeks. 1985 in Berita Harian. So they're explaining what is ultrasound. Perkataan ultrasound kini sudah menjadi satu perkataan yang tidak asing lagi bagi kebanyakan wanita hamil. Sebab semakin ramai antara mereka yang kini pergi mendapatkan pemeriksaan ultrasound untuk mengetahui keadaan kandungan mereka. Tetapi sebenarnya teknologi ultrasound bukan merupakan satu perkara baru. Ia digunakan pertama kalinya 70 tahun lalu untuk menguji ketebalan air batu di Atlantik Utara untuk mencari kapal Titanic yang karam di sana. Okay, so this thing is not a new technology. It's been around for 70 years, but now it's becoming popular. Like more women are talking about it because they are also getting such scans. So they explain how the technology works, the sound rays. Okay, dibandingkan dengan alat X-ray, ultrasound tidak menimbulkan bahaya pada tubuh. Jadi compare X-ray and ultrasound. Ultrasound does not pose any risks compared to X-rays. Ultrasound can be used to give a lot of information, including diagnosing abnormalities or disabilities with the fetus, to see if there's twins, multiples or not, to measure the size of the fetus, and to check the fetus is healthy. Acknowledges that it's sometimes being used to tell the sex of the baby, but it's not that conclusive because sometimes the information gained with ultrasound can be confusing. So this sounds more on par with the images that came out of the 80s, the ultrasound images, very blurry, and also from the anecdotes that I have heard, like my peers, okay, who were born in the 80s, said that when their mother was pregnant with them and the doctor said they were having a boy, actually it was a girl. So it was not that conclusive. Now, 1985. In the Singapore Monitor, women warned of ultrasound. The Health Ministry has cautioned its clinics on the use of ultrasound screening because of possible harmful side effects on unborn babies or mothers. Professor Salman, the head of B Unit of Kandang Kerbau Hospital, said that the ministry decided to act after a research panel of the US National Institutes of Health reported that after 20 years of use, there is no proof that ultrasound is safe and beneficial. There were some animal studies found that ultrasound might slow prenatal growth. So Prof. Salman said doctors should only use it if there are problems during pregnancy. It should not be used for mere identification of the sex of the fetus, to see the baby move, nor for the sake of making a visual record of the unborn baby. We must not pander to the curiosity of patients. There is growing suspicion in medical circles that at least a few general practitioners not trained in the use of the machine and interpretation of the image are using ultrasound to make a quick buck. One private radiologist said, the machine is very expensive, about $50,000. And this was in 1985, so you can do some calculation on how much that's worth. Now, that's why doctors try to make use of it as much as possible. A gynecologist who uses the technique played down the risk factor. It's safe, he told one patient. I've been doing it for 11 years. It is not like an Xray where there is radiation. Another Mount Elizabeth doctor said, apart from the medical reasons, we also have to think about consumer satisfaction. I have seen how happy and excited a mother gets at seeing her child in the womb. It is such satisfaction that has led some clinics to videotape the black and white images. So here they mentioned 3 private doctors, private radiologists, gynecologists, and a general practitioner who are using the machine. So we know that there was one machine at the public hospital, but it came later. So here it says, I've been using it for 11 years. So 1985 since 1974. That's before the public hospital got their first ultrasound machine. 1985, ultrasound scan warning. The same thing, but in the Straits Times. So quite cautious. And then another article, doubts raised over the safety of womb scanning. This is by the critics of the Britain's RCOG, Royal College of ONG. So there was one Dr. Chalmers who said it is foolhardy to say it is completely safe. Now there is a group called the Pressure Group, Association for Improvements in the Maternity Services, who said that there was the report. Okay, so there's a report given by Britain's RCOG, and then this group is dissatisfied with the RCOG and say that there's no evidence that it is safe. And here, Dr. Marston Wagner, he's quite critical of obstetric interventions for pregnant women. So he does not share the optimism. He wrote a letter to AIMS and said that there was a trial in Norway that showed there was some benefit, for other studies show there are no evidence of any advantages. The evidence to date is that routine scanning during pregnancy does not affect the pregnancy outcome. Same year, this is an article with the image that came with the article. I think I maybe see the baby's torso or the skull. Hard to tell. 1985. Okay, the Singapore ONG Society wrote an article referring to that previous one about the warning and said that it's safe. Diagnostic ultrasound is safe for use. In a detailed review of the literature, we find no study which clearly demonstrates that there is any effect on the mammalian fetus from ultrasound of diagnostic intensities. While it should not be used frivolously, there's definitely a place for it. In 1988, US doctors urged 4th month ultrasound tests. So they want to use the test to look for birth defects such as Down syndrome and other major congenital abnormalities, osteogenesis imperfecta, a birth defect in which the child suffers broken bones, and fetal heart block, where the fetus's heart fails to beat strongly enough. And this condition can be treated before birth by giving the mother digitalis. In 1989, an American professor recommended that pregnant women should avoid ultrasound therapy. There's no confirmed evidence. We don't mean to suggest that ultrasound treatment has been shown to have any detrimental effects, but a physician has to weigh the benefit against a risk that has not been quantified. So here they're talking about diagnostic scans versus ultrasound therapy. So therapeutic ultrasound is used to treat conditions such as back pain or muscle injury. And they said that diagnostic ultrasound, because of its short duration pulses, seems to be no problem. So it's safe because it's short. But they do mention here cavitation. Cavitation is the formation of cavities in a fluid by waves or forces moving through the fluid. This can lead to gas bubbles in previously bubble-free fluids. Cavitation can take place in cells in a test tube with ultrasound levels equal to those used in human therapy, but damage in animals only occurs at higher intensities. So in this article, ultrasound is safe because it's a low intensity. 1990, Straits Times says that one ultrasound scan is enough for normal pregnancy. According to an Australian expert, most women in Australia undergo just one scan between 14 to 18 weeks to check for abnormalities of the spine, the head, the kidneys, and the stomach. And then they say if the pregnancy is normal, she does not need to go for another scan. While several doctors in Singapore agree that it is not necessary for most women to go for a scan more than once, they add that regular checks have a positive effect because babies are of such premium in Singapore that if it gives the mother peace of mind that her baby is developing normally, such a scan is therapeutic. So here it's a therapeutic, like it's psychologically therapeutic, but physiologically it's not really doing anything for her. Many baby packages offered by private ONG doctors also include ultrasound scans as part of the monthly follow-up from the third or fourth month. And the Australian doctor said that there's little danger from ultrasound scans at the low doses. In 1990, plans for an ultrasound scan training school in the Straits Times. So please note that the ultrasound has already been used for 15 years in Singapore at least, maybe a bit more by now, and by private doctors longer than by public doctors. I mean, doctors in public hospitals. And in 1990, a training school for ultrasound scanning may be set up in Kandang Kerbau Hospital. This is something for the future. We can look into collaboration with overseas examiners. KK Hospital is at present conducting its first ultrasound workshop for GPs and ONG specialists. At present, there is no formalized training for ultrasound scanning, although many clinics in the private practice have ultrasound machines. There are fewer than a handful in the profession who have some formal qualification and overseas experience. So I think this shows how commercial aspect of it moves, the commercial aspect of technology moves faster than the regulatory aspect. So for the state to catch up and regulate and provide, in this case, like local training, local education on the technology, that takes more time. 1992, in Berita Harian, the Malay newspaper, ultrasound does not affect the pregnancy. Okay, very reassuring. Based on a study in Norway by Dr. Salvesen, he did research on 900 children whose mothers went through ultrasound while pregnant with them. These children, aged between 8 to 9 years old, showed that they had the same performance as other children whose mothers did not do ultrasound because there has been a lot of worries. As we saw in just a few articles before this, they were saying like don't scan, and then someone saying it's okay, it's safe. However, that study did find that 21 out of 309 children, let's see what percentage is that. So what is this? 6.8%. They had problems reading. Okay, so those whose mothers scanned, okay, 6.8% of the children had problems reading compared to 26 out of 294 children who did not go through ultrasound. They have problems reading. Okay, so it's more. So more. In the group that did not go through ultrasound, there was a slightly higher percentage of children that could not, that had problems reading. So I don't know. It's it's kind of not going the way that you expect, right? Okay, but in the total study of all the children, 603, the researchers did not find much difference between their reading, spelling, and mathematic abilities. So don't worry. 1993, the Business Times, ultrasound scans not essential. According to a Swiss study now, the routine scans have become the norm, but was not necessary unless it is carried out to check for abnormalities. The researchers said they had pulled data from several previous studies which showed that the live birth rate was the same in women who had not had routine scans as those who had. 1993, same year, the Business Times, there was another study in Norway. They surveyed the parents of more than 2,000 children, said they found slightly more left-handedness among children screened by ultrasound than those who were not. Same year, in the new paper in Singapore, ultrasound tests are wasteful for most. So keep in mind, before this, in the 80s, there was guidelines to have 4 scans in a pregnancy, to have 1 at 7 months, to have 1 between 14 to 18 weeks. But if it's a normal pregnancy, then just 1 scan is enough. And then here it says such tests like routine ultrasound do little to ensure that a child born to a low-risk mother will be healthier. and they are worried about the costs. This is the most significant report to date which questions the routine use of ultrasound screening. The new study does not question the effectiveness of ultrasound for pregnant women who have potentially serious medical problems and for whom the test has been found to be useful. However, the number of abnormalities detected by ultrasound does not appear to support a national policy for routine ultrasonography. Here they mentioned that the former West Germany adopted the practice in 1980. Okay, so here they're worried about unnecessary testing, overtreatment, and growing healthcare costs in the US. This is saying the same thing, I think. Okay, it's a waste of money. It is performed routinely. Okay, typically, family doctors and obstetricians recommend that women get two scans during pregnancy, one at between 15 and 22 weeks, and a second between 31 and 35 weeks. The test costs about $200 each. In the Berita Harian, the Malay newspaper, they mentioned that same article. So just in Malay, ultrasound scans are wasteful. This is 90, oh no, I cannot see the date. I think 95 or 96. Australian researchers had found that frequent ultrasound examinations during pregnancy might restrict a baby's growth. In a report in The Lancet, the study found that women with several scans were more likely to have small babies at birth. Women who had 5 or more examinations were more likely to have been given a diagnosis of small foredates or intrauterine growth retardation. They said the researchers were cautious about the results and could not identify any other factors which could explain the impacts on fetal growth. They called for further investigations into the effects of ultrasound scans. Also, 80% of all mothers-to-be were at such low risk that they did not need ultrasound scans unless problems arose. 94. In Singapore, Advanced Technology Laboratories Incorporated, a world leader in the development, manufacture, and distribution of diagnostic medical ultrasound systems, has opened a sales and service subsidiary in Singapore. Government and private hospitals using ATL systems include the National University Hospital, Thomson Medical Center, Gleneagles, Kanakaba Hospital, and Mount Elizabeth. So 2 public hospitals and 3 private hospitals. ATL is the first ultrasound company to have introduced an all-digitalized broadband ultrasound technology called high-definition imaging. According to ATL, physicians say this technology allows them to visualize anatomical detail previously not seen with ultrasound. Last year, it had revenue of US 360 million or Singapore dollars 540, nearly half of which came from outside the US. I think this is a great, a great example of the commercial aspect of it. So, of course, if the company opens, here is a sales and service office in Singapore, and it's meant to even provide support to the whole customer base in Asia, then obviously here our hospitals will be using it. And this is the first mention, 1994, of the high definition imaging. So possibly this could be is it the standard we get now? They can see the organs where they do a very long scan at about 20 weeks. They call it the anatomy scan, where they look at every single organ and measure it. So could this already be that high imaging? 1996, usah terburu jalani ultrasound. Don't be in a rush to go through ultrasound. Based on a study, where was the study done? In 1993, it said that there was no benefit that could be gotten from routine scans. It does not reduce the number of fetal deaths or improves the health of babies that are just born. And definitely there are more keganjilan janin, fetal abnormalities that are found in the group that were tested. Namun, kajian itu namun pengesanan awal tiada kesan ketara seperti meningkatnya pengguguran atau jagaan lebih baik bagi bayi baru lahir. Para penyelidik itu merumuskan ultrasound umum hanya meningkatkan kos jagaan sebelum lahir tanpa memperbaiki keadaan bayi. So they're concerned that it just raises costs rather than actually improving outcomes for the baby. (1999) I just put this in because it sounds like another optimistic suggestion of what ultrasound could be used. So before this, in the 80s, it was already being used to treat back pain. So some kind of physical therapy. ultrasound therapy, and then now they're saying, oh, maybe we can use it to treat cancer. Ultrasound beams could one day be used to destroy cancerous tumors without damaging the surrounding healthy tissue. So how they would use this? By a trio of ultrasound beams focused on the same spot would be strong enough to destroy cancer cells with an accuracy of 0.5 millimeters. So if you use 3 ultrasound beams for a prolonged period, you can kill cancer cells. Remember, there was one article that said that because of the short pulses of diagnostic imaging, it's okay, it's safe. And finally, okay, this one is an article from 2004, but I just put it in because it's quite a departure from what we saw in the 70s, 80s, and the 90s. So here in Today newspaper, the headline, "See the tiny organs of a fetus with Philips' new ultrasound system." A mother-to-be can now see the tiny organs in her fetus from as early on as the second trimester. Even the chambers of the heart can be seen in real time. Let's check that date. When did ATL come? 1994. Maybe that could be this could be the technology for today, that we see today, I mean. This breakthrough, made possible with the new imaging technology of the Philips IU-22 intelligent ultrasound system, provides doctors greater sensitivity and reach to body parts that they could not scan previously. By being able to detect defects early, doctors can recommend corrective action or surgery for the baby. I assume after birth, there's not a lot of things being done, even if you diagnose something during pregnancy. Describing it as a truly real-time 3D ultrasound. Oh, so this Philips one is 3D ultrasound. Chief of the ultrasound department of the University of Chicago said the problem in the past is that there are slow frame rates that make the image chunk along. This one is very quick with smoother motion. Launched on Sunday, the only doctor to own a set here for now is Dr. Chu of Mount Elizabeth Hospital. Each scan costs between $100 and $250. Okay, so it was a private doctor at a private hospital that owned this device. So that remains to be seen how it also caught up with the public hospitals. As far as I know, when I did my research in 2020, 3D ultrasound is only, and also now they have 4D ultrasound, that's only available in the private hospitals because the public hospitals only give you what is necessary, what is needed, and that is maybe that 1994 technology from ATL, not this 3D technology. Okay, so that's it. I hope you enjoyed that kind of walk through history. And if you're interested, you can pause the video. You can look up the headlines on the e-newspaper websites, and you can see how public perception changed through the years, and also that there was actually a lot of studies kind of showing like potential risks, and then some studies didn't find anything. So basically, there was just no consensus in those years. So I think later on, there were also some systematic reviews being done after the year 2010 that also showed that there are no systematic benefits for this technology. So if you like this video, please subscribe, and also let me know if there's something that you'd like me to look at, some kind of technology related to pregnancy and childbirth. And I will see you in the next video.